Interpreting test results. I know, I love this picture. Okay. No test is 100% accurate, and interpreting these tests can be really frustrating. And like I just said, testing at a particular moment in time has its limits because a cat can subsequently clear the virus, or the cat may not have virus in its blood yet but has been exposed. So when appropriate, you guys can run a confirmatory test like we talked about. And so if you have a cat that looks suspicious to you and it's negative on the SNAP test, but you're like, oh, this cat kind of speaks the picture of FeLV to me, maybe thin, has big lymph nodes, chronic upper respiratory, run a confirmatory test on these guys. It's never wrong. And then if you have a positive cat that's really highly adoptable, you can choose these cats to run an IFA on and see if their bone marrow is affected. And then versus FIV, which Dr. Putney will talk about, vaccination does not interfere with the test. So if your cat has been FeLV vaccinated, that does not affect the test. So can you trust a negative test? And for the most part, yes, and it has to do with the concept of prevalence. So prevalence basically means the percentage of cats in a population that are positive for the disease. So in healthy cats in Ithaca, in most areas, the prevalence is about 2%. So because of that, a negative test can usually be trusted. But remember your clinical picture. If you're not trusting what the test is saying, it's okay to run a confirmatory test. So what if you guys get a positive test? Because in healthy animals, the prevalence is so low, a positive test on a point-of-care test in a healthy cat has a reasonable chance of being a false positive. And by false positive, I mean a cat that tests positive but does not have the disease. So given your mission, and we understand that everybody comes from different places, right? You can run a confirmatory test like we talked about, one of these options. You can select your highly adoptable cats for a confirmatory test, or you can euthanize FeLV positive cats.